RFK Jr.'s hand-picked CDC vaccine advisory panel is meeting right now as it considers more changes. They have already voted to not recommend the combined measles, mumps, rubella, and chickenpox vaccine for kids under 4, saying the chickenpox vaccine should be given separately. And today the panel delayed a decision on the hepatitis B vaccine for newborns. Joining us now, NBC News national correspondent Aaron Gilchrist, who is at the CDC in Atlanta. Aaron, bring us up to speed.
So, Katie, I'll tell you where we are right now. We've been really focused today on the COVID-19 vaccine, and we just reached a point where there is going to be a vote in the next few minutes on the 4 questions that this panel has to consider, which we've just been handed a few minutes ago here. 2 of the questions that they're going to vote on really are about providing more information to people before they get a COVID vaccine. The other 2 questions address the immunization scheduling, and the question that they're going to vote on is changing the current recommendation that the CDC puts out, which is that people 6 months old and older get the COVID vaccine. The new recommendation, if approved and endorsed by the CDC director, would be that vaccination should be based on individual decision making, or what they called shared clinical decision making. The same thing, essentially saying that vaccination should be dependent on whether a person and their doctor decide that they want to get vaccinated. For the younger age group, people under 64, there would be some additional information that would be recommended to be shared with patients. The other significant thing here is that they want to recommend that people be required to get a prescription for a COVID-19 vaccine. The recommendation would be that state and local jurisdictions require a prescription for the administration of a COVID-19 vaccine. That would be new, and one of the medical groups that's listening in and able to chime in on these conversations expressed some concern about that part of the vote, saying that this would create barriers to vaccination. Namely, it would create an unnecessary step, they say, and that it doesn't effectively target high-risk populations. There are questions about affordability, of course, as well. There are concerns about whether this might create some confusion for pharmacies, where many people get their vaccinations now without prescriptions. And so that's really been a key part of the discussion that's happening now. There's a public comment period that's underway as we speak, and then the vote will happen. And we'll find out likely in the next half hour or so, Katie, where this lands.
All right, Aaron, thank you very much. Joining us now, senior scholar at the Johns Hopkins Center for Health Security, Dr. Amish Adalja. He specializes in emerging infectious diseases, pandemic preparedness, and biosecurity. All right, so one of the big questions that people have is, if this panel stops recommending a vaccine or a schedule of vaccines, will insurance still cover it?
I think that's one of the big questions, because the way Obamacare has kind of codified it, if AICP recommends something, then insurance companies are mandated to cover it. What we've heard from the American health insurance plans is that they're planning to cover everything based on the prior schedule, and that they're going through their own process to determine what they're going to cover going forward. So I think in the short term, at least through the end of the year, I think everything will be covered if what we're hearing from the insurance companies is correct. But unfortunately, ACIP is really tied to the way insurance companies work because of that policy, which is going to need to be refined and revised now that ACIP is non-functional.
Let me ask you about the MMRV vaccine specifically, because the recommendation of the panel, I want to clarify it. It's not saying don't get it. It's just saying don't get it all at the same time. Does that matter?
Only about 15% of parents were getting their child vaccinated with the 4-strain vaccine for the first dose, because we already have known about this risk of febrile seizures, or seizures that you have when a high fever spikes, when you would give all 4 at once for the first dose. So most people were already separating out the 3 and 1 and then the 1. What's gone on now is that they've said they don't recommend that 4-strain version at that time. But yes, they are still recommending that you get MMR and the varicella vaccine separately in separate shots for the first dose. So this was really something, because the anti-vaccine movement has been so anti-combination vaccines, that they wanted to go after, even though this had already been addressed by prior advisory committees on immunization practices, and something that we already were doing is mostly separating those vaccines. But again, this is kind of real red meat for the anti-vaccine movement, so it's not surprising they took that vote, but it's not going to make much of a difference in general, although it just makes people more confused and distrusting of the whole process.
Okay, so just again, it's measles, mumps, rubella, and chickenpox, which is the V and the MMRV. If your doctor, if you go to your pediatrician, now are they required to recommend it, or what kind of information is your pediatrician now required to give or going to give? What sort of, I guess, guidelines are they following when you bring your infant and your toddler in to get these vaccines?
Thankfully, the American Academy of Pediatrics has developed its own immunization schedule, which is based on science, which is based on clinical data, and that is what most pediatricians are going to follow. And for decades, the CDC and the American Academy of Pediatrics had identical schedules. Now they're diverging because CDC has now been taken over by RFK Jr. So hopefully most pediatricians are going to follow the American Academy of Pediatrics schedule, which is pretty much identical to the ACIP schedule prior to RFK Jr. Destroying that panel.
So what are you watching for next? They're meeting right now, they're voting. What is going to be potentially very consequential, in your opinion?
So it looks like they are not going to make any decisions on hepatitis B. That was something we were really worried about. It looks like they've postponed that indefinitely. But they are going to make decisions regarding COVID vaccines and who is going to be recommended to get a COVID vaccine. There's also talk, as you heard from your reporter, about requiring a prescription for COVID vaccines. And if that becomes the case, that is going to erect a tremendous barrier for many people to get vaccinated, which is exactly what RFK Jr. has been wanting to do. He's been making it harder and harder for people to get vaccines, while not technically removing vaccines from the market. He's just putting all these hurdles. And I think that's what ACIP is likely to do, is continue to make it harder for people who want to be vaccinated against COVID to get vaccinated against COVID. And I think that's what we have to really watch, because we may end up with increased preventable hospitalizations in deaths if high-risk people are unable to get COVID vaccinated.
All right, Dr. Adalja, thank you so much.